that I'm going to talk about today are just some different types of careers that you can have in research. So there's medical careers in research. So when you think about research, they're typically at the top level. You have academics and you have medicine, and those are the two avenues. So you have medical doctors who do research, and you have PhD professors who do research. They typically are doing the same types of research, just in a different population. So when you look at medical research, you're also oftentimes thinking about clinical trials. You're thinking about a specific patient population. So if you're doing clinical trials, it's typically you are a physician who does a specific type of practice. So you specialize in stroke, or you specialize in ALS or some other kind of disease. And that's your patient population. And so those are the people that you tend to want to help get better. And doing clinical trial research is all about trying to find drugs, trying to find devices, trying to find treatment modalities that will make people better. There's also development that can happen in medicine. So any kind of device that you may use was developed typically by a physician and a team of engineers who are trying to figure out the best way to make something work in your body, but also how to make it function for you. So if you break your leg and you have to have metal put into your leg, you have a physician that helped design the metal that's going in your leg, and an engineer who figured out how that's supposed to all fit together. And then you have somebody from the device company who comes and shows them all how to put it all together. So you have three very distinct people essentially in the same room making it so that you can walk again. And anytime you have anything in medicine, any type that you have things like that in medicine, typically there's a lot of research, there's a lot of background that's come into it, and a lot of different people. Academic research or scientific research, so there's a few different kinds of research here as well. So in academics, oftentimes you think of professors. Professors can have an academic career, or they can have a teaching career. And they can have both of those things together. Academics, the careers in academics for research are it's a pretty tough deal, in the sense that tenure is the gold standard. So there's lots of publishing, there's lots of research, as well as teaching that comes along with it. So there are a lot of requirements that have to come into it. There are some benefits about all of these, and I'm going to talk about the benefits of each one of these in just a second. But I just wanted to kind of give you an overview of some of these things first. There's also commercial research, which there's marketing research for health products. There's also marketing research for just about any kind of products. I know mostly about health products. And then there's pharmaceutical research. So a lot of you with a background in biology, or who are pursuing a degree in biology, working for a pharmaceutical company, working on development of pharmaceutical drugs, working on testing. There are lots and lots of research careers that you can do with pharmaceutical companies. Out of these three these three categories, pharmaceutical companies are going to pay you the best. They have the most money, so they're going to be able to pay you the most. They may not be the most wonderful place to work, though. So that's something that you'll have to decide as far as your work-life balance. So when you talk about medical careers, you're a physician and you're doing research. So what your life looks like is you work your regular physician job, you work in a clinic, you work in an ER, you see patients on a pretty regular basis, and then you do your research on top of that. So it's a pretty big time commitment. Doing research in medicine is very much passion. It's very much about you have the thing that you study, and that is the thing that you want to do. Academic careers, again, I was talking about this earlier. They're oftentimes you teach and you do research simultaneously. So when you kind of look at the percentage, so for a medical faculty, they might be in clinic 80%, and the rest of theirs is split between research and doing committees and things like that. Academics, you may be 80% teaching and then fitting the rest of your research and stuff. So you still have a lot of commitments. It's not oftentimes that you just get to do research and you don't have to do all of these other things, because you still have to be able to bring something in order for them to want to keep you around. So I have my bachelor's degree is in psychology, my master's degree is in health education, and my PhD is in health behavior. So I studied at Indiana University at the Kinsey Institute for Sexual Health, and my research was in women's sexual health. So this was something that I was very passionate about from the time I started. So I started studying this when I was a psychology student. I started studying sexual pain disorders in women. And I picked the school that I went to because it was the best in the country for what I wanted to do. I spent 10 years in higher education. And so that's through my undergrad, master's, and my PhD. I did research all throughout the whole thing and did research at multiple levels. So as a research assistant, as a lab assistant, as the PI on projects, I wore lots of different hats throughout that time. I also taught at Indiana University and the University of Michigan last year while I was doing these things. So one really great thing about academics, if you're interested in going into an academic career, is that you oftentimes can get your higher education either paid for or at least subsidized a little bit by working in a lab, by teaching classes, by being a graduate assistant. And that makes a really big difference when you're looking at getting out of school after 10 years and having no debt or having very little debt. So something to think about as you're moving along in your career trajectory, you're thinking about what you want to do. Maybe you want to get a master's, maybe you know that's something already that you're looking forward to. So who's somebody that you can connect with now that might be doing some research, that you could get some experience, that you could talk to and see what the next steps would be for you? Those kinds of networks are going to be really essential. So I've done both medical and academic research. My last job, I was research faculty at the University of Michigan in family medicine and gynecology. And I did a lot of work with the ER department with clinical trials as well. So I've had a lot of different opportunities to see lots of different sides of those. So just some different types of positions that you might think about or might look into, or names that you might see or hear. I'm so sorry, I totally blocked it. Principal investigator or research faculty is going to be the person who's in charge of a research study. So that's going to be the top person. They're going to be the one who is bringing people into their lab. They're going to be the one who is bringing people onto their team, whether it's a clinical trial team, a lab setting, or just a research project. Oftentimes, you'll have research coordinator positions. These are really great. This is a really great way to get into research and see if it's something that you're interested in. Oftentimes, you can have a bachelor's, even have a master's, but sometimes even with a bachelor's degree. The coordinator basically does that. They coordinate all aspects of the research. So they coordinate all of the people who are collecting the data. They coordinate all the places where the data is being collected. They coordinate pretty much everything that is happening within the study to make sure that all of the checks and balances are going the way they're supposed to. Statistician, anybody like stats? Anybody taken stats yet? Yeah, a few of you. Yeah, stats, it's super fun. So if you're a statistician-minded kind of person, every single research project has a statistician on board. They have somebody who is running all of the numbers, saying how many people do we need to have significance, how many people do we need to recruit, how many subjects do we have to have. checking all of those things continuously. The one clinical trial that I've been working on for, oh gosh, it's been about 7 years I've been working on this project. There are biostatisticians from 6 different universities across the country. And we all would get together like 3 times a year, and everybody would talk about all of these things, and it was really amazing, really far over my head, all of the stuff that they were talking about. But thank goodness there are biostatisticians who want to do those sorts of things and calculate all of that and figure out exactly what it is that you need to do. So if that's something you're interested in, that is always that's a great avenue to be able to take in that kind of career. And that is also like a master's level. You can absolutely work as a statistician at a master's level. Research assistant, this is where you're probably going to start out. If you're thinking about doing some research now, if you're thinking about getting involved in some project that somebody has, you're probably going to start out as a research assistant. And what that means is you're going to start out as the person who collects surveys, or the person who copies surveys, or the person who gets people to sign their consent, or the person who recruits people. So research assistants, you're very hands-on, you're very right in the thick of it, and you're going to be doing a lot of the work. It's not a bad place to start, because you really get an idea of how it all works, how it all runs, and where you can go from there. Lab techs or assistants, this is more on the biology side of this. So you have, or the hard science side of it. If you're working in a lab, you have, you may be just running samples. You may be just in a lab, never seeing a person, and just working with samples or working with data in that way. So the nice thing I feel like about research is that if you're an introvert, if you're an extrovert, you can really find something for yourself to where if you don't want to hang out with anybody else, you can go work in a lab. If you want to interact with people all the time, you can be a research assistant or a research coordinator and be right in the forefront. You can be the person who is recruiting people and talking to people all the time. So my research was with women who had a condition called vulvodynia, which is a neuropathic pain disorder of the vulva. I know, it's way late in the afternoon to use the word vulva, but so neuropathic pain of the vulva, it's pretty common, but it's not really something that a lot of people talk about. But I worked in a clinic with a physician that we worked in the clinic. We had a specialty clinic. We saw women in this clinic, but we also did research on this condition to try to figure out why women have this condition, what we could do to make it better, because it's debilitating and horribly life-altering for women. At some point, this is not a job anymore. This is a passion. Like, these women come to you in clinic, their whole life is like essentially in your hands to say, help me. And that becomes something that you really get into. That's my personality. I loved interacting with people in that way. I loved hearing people's stories. I loved being able to like try to offer them something in order to help them, you know, even if it was just in listening to them. Some people are not that way. My husband could care less about listening to anybody. Maybe it's because I talk a lot, but either way, he is the lab guy, right? He's the guy who wants to sit in a lab and not talk to anybody and just do his thing and go home. And that's awesome, because there's those types of things for both people. So these are just a few different things that if you were looking for jobs, these are some of the terms you're going to see. These are some of the things that if somebody's advertising, you're probably going to right now see research assistant. Well, what does that mean? So research assistant for you guys is going to mean probably a part-time job, probably making $10 an hour because of where you're at. A research assistant in a bigger project, you might be looking at a little bit more, looking at fuller-time hours, but that's kind of where entry level is going to start, is with, you know, research assistants. So just something to be thinking about if you're thinking that you might want to look at careers. I'm sorry, I need some water. Just something to think about as you're moving forward and thinking about what kind of areas you're going into. So everybody likes to get paid. When you have a job, it's really nice to get paid. So another really important thing when it comes to research is how you get paid or who's going to pay you. So the two most important things for you to know are the difference between hard money and soft money. So lots of research jobs are soft money, which means salaries come from grants. So if you don't write grants for the next cycle to continue your funding, you don't have a job. So one of the things that lots of big projects have, big federally funded projects, is that they have a grant writer on staff, and that person just writes grants to make sure that you always have funding. Because on a big project, you could have 100 people relying on your grant in order for their income. So soft money is usually a little bit better paid because you can write into the grant what you think you're worth. However, it isn't a guarantee. So usually grant cycles work for a year or 3 years or 5 years, however long that is. Anybody who works on a grant or who works off of grant money, they are continually writing another grant. Or somebody in their group is continually writing another grant to keep the money coming in. So grants come from federal funding. So the NIH, the children one, I can't think of what that one's called. National Institutes for Children's Health or whatever. Anyway, a lot of funding comes from the government in order to do medical research, in order to do academic research. It's really, really competitive. So if you aren't interested in competing for your salary by writing grants and doing those things, a soft money job is maybe not the best option. There's also a lot of oversight that comes into soft money. So if you have an NIH grant, the National Institutes of Health, you have hundreds of hoops that you have to jump through in order to keep your funding. So you have to make sure that everybody's collecting the data in the way that they're supposed to be collecting the data. And you have to report on all of the things that you're spending money on and everything that's happening. And as long as you're on a project that's on the up and up, it's not a big deal, but it's a lot of work to keep that up and going. So when I first started at the University of Michigan, we did this amazing study with 2,500 women randomly chosen in a 4-county area of Michigan. And they filled out surveys, and then once they filled out these surveys, we brought them into our clinic. We did vaginal exams on them to test for hypersensitivity. We did specimen testing, and then we followed these women for 5 years. And so twice a year, they would come back into our clinic, and we would do all of this testing over again, and we followed them, and we did surveys with them for 5 years. It's a lot of data. That's a lot of bringing people in, a lot of paying people money to come in because all of the research subjects got paid. Well, when we first started on this project, this was a 7-year project. That the grant for this project was, I think, $4.5 million, spread out over 7 years. We hired a research assistant who was the person who was going to go to clinic. She was going to do the exams and take samples. Well, about 6 months into this, we realized she wasn't actually going. She was making it all up. She was filling out her papers and making it up. And that's a really big deal. That's a really big deal to the NIH, who just gave us $4 million to do this study. And so, we had to do a lot of backpedaling. We had to bring every one of those women back in. We had to pay them extra money to come back in. We had to try to save our credibility on a longitudinal study. We wanted these women to stay there for 5 years and to participate in this study. Like, that's a really big deal to happen in the very first part of the study. It also is something that, you don't ever know what you're going to get, right? And had the NIH, or had we not accommodated, had we not reported that this had happened, had we just pretended like, oh, we won't tell anybody, nobody will ever know, the PI on the project could lose the ability to apply for federal funding for life. I mean, it's a big deal. The federal government does not want to give you money, and they really don't want you to misuse it when they do give you money. So, soft money jobs, mostly through the government, those are going to definitely be great opportunities, but maybe a little, you have to work a little bit harder for it in that sense. Now, hard money jobs are institutional paid. So, like you work at a university, you're research faculty at a university, or you're tenured faculty, so you have that, you know, split of your time. So you're teaching 3 courses, and then you get to do a little bit of research on the side of doing your service as well. So there's not as much wiggle room in salary when it comes to that. Learning how to negotiate your salary is an essential thing that is a skill that not everybody has. Very few people are good at it, but if you can learn it, do it, because it will be very beneficial to you, especially in academics. Most things can be negotiated. What your teaching split is going to be, how many classes you're going to teach each semester, how many committees you're going to have to sit on, how much time you're going to have to give to service, how much time you're going to have for research. If you're in a lab, if you want to set up a lab, that's thousands and thousands of dollars. So being able to negotiate them setting up a lab for you before you even get someplace, those are really essential things to be able to negotiate into a contract as you're going out into the job field. So a few really great things. I have some salary stuff I was going to show you. A couple of really great things about careers in academia. It's sort of flexible. You can kind of work based on your schedule, based on your teaching schedule, based on when your patients are in clinic or wherever it is you're recruiting your patients from. So you have some flexibility, which is really nice. But you also can have life-sucking flexibility in the sense that you are available 24 hours a day. And this is one really big problem with research in general, is that when you start out in research, you're very eager to help out and to be a part and to do everything that you can, and you answer emails in the middle of the night and you do things that any other job would never request of you, but this job does if you let it. So just being aware that setting good ground rules for yourself as you go in to say, this is not a 9-to-5 job. It doesn't really work that way. But you can set up the parameters for yourself as to how you want to work, so it doesn't become this like life-sucking thing. So tenure takes a lot of publishing, a lot of presenting at conferences, a lot of teaching, a lot of doing a lot of service. And all of those things take a lot of time. And so if you are a PhD who is interested in the tenure track, which a lot of people are, some people aren't, that's a really big commitment. That's a 7-year, this is all I'm doing with my life commitment to try and reach tenure. On the other side of that, you can be academic faculty and be on soft money and not have to worry about tenure. So I myself was not ever interested in tenure. Once I had kids, I was not interested in the idea that I needed to do all of these things. I wanted to have it my way and not this way. So you can still do research and you can still teach and not have to do the tenure track, which can be a little bit scary for lots of people and can be a very big commitment on your time. So here are some just ranges. I know these are big ranges. This is the crazy thing about academics. People don't go into academics to get rich. They go into academics because they have something that they want to share with other people, or they want to, give this knowledge to students. They want to do this kind of research, those kinds of things. This 115 for faculty research, that's after 15 years. 15 years of doing your job. Most people are going to start in the 50 range and creep up pretty slowly. You can subsidize or augment your salary by having part of your salary paid by a grant. That's always an option too. But yeah, research faculty, they're not doing this for the money. Now, obviously, medical faculty who do research, they're making what a neurosurgeon makes, which is more than $115,000, by the way. So they have a little bit different situation. So they're making what their salary would be as a physician, and then they're just getting the research part of it on top of that. So like I said, the research coordinator, statisticians, lab techs, all of these kinds of things, on a soft money, they can be written into the grant higher or lower, except for on some federal grants, because the government says you can only pay people this much for this type of a job. So there's a little bit of wiggle room, not a ton. There is vastly different ranges across different universities. I started at Indiana University as a graduate student there, where I did my doctoral work. I went to a medical school as a PhD in a medical school. You would make less money because somehow having a PhD is not nearly as cool as having an MD, even though you're all doing the same kind of research. So where you're at makes a very, very, very big difference. Also, where you're at geographically. How much research do you think is happening here in Billings, Montana? Not a lot. You're right. So that's something to think about. You're going to have to go to a place that has a medical school or a larger university where they can bring in grant funding, they have lots of students, and they have more opportunity to bring in that kind of money. Here, there's research happening at the Cancer Center. There's a lot of great research happening out there. There's a few physicians that just independently do research here on the things that they study or the disorders that they work with. But yeah, in small towns, there isn't a lot of research opportunities. There is some of this kind of stuff that you can do online, but that's a network issue, right? You have to be in before you can get to that point. So you can work on a research project. I've worked on a research project in Michigan for years, but because I started there, they knew me already. I didn't have to seek that out. So there are some of those opportunities to work long distance, but it's not nearly as easy to just find. Some of the perks of working at a university and doing research, other than being able to kind of make your own schedule, insurance is better than in medicine, believe it or not. If you work in medicine, notoriously terrible health insurance, which is ridiculous, but nonetheless. You also get some opportunities to present your research at conferences in other parts of the world, which is pretty nice perk of having a great job. That I have presented work in Scotland and in Paris and in Spain and in New Zealand, and all of it paid for my grant. So it gave me the opportunity to take my family and go on a great vacation and go present some research to some people in another country, which was pretty awesome. So that's, I feel like, is a pretty good perk. You also get the great satisfaction of knowing that you're really helping discover something that somebody else doesn't know. And that's pretty awesome. When we think about all of the scientific breakthroughs that we've had in our lifetime, all of the medications that we have, all of the different things that we have that make our life better, that's because somebody did research on it at some point. And that's pretty cool to be able to be a part of. So That's it. I just have some, if you have some questions, I'm happy to answer any questions. I know I just kind of rambled on for a long time, I'm sorry. Nobody?
What would you suggest doing as an undergraduate at Rocky Mountain College to help set off a research career?
Yeah. So, absolutely. You're doing some research?
Mm-hmm.
Yeah. Right here. There's probably...
A plug for me.
Yeah, no, there's lots of, but that's the thing. There are lots of people. So, once you get a PhD, you kind of just continue to do research because that's how you're trained and that's just kind of how it works. So, even if you don't have huge NIH funding, you still do research. And it may be small scale, but what better place to start than right here? So look at the people who are teaching your classes, look at the people who are working in your labs, and ask them, how do I get involved in something? Look at flyers that are hanging out in the hallway that are advertising that research is going on so that you would know what people are doing if there's something that's interesting to you. Anything that you can do at this level to get yourself involved, first of all, is going to say whether you really like it or you don't like it. Because maybe it's not for you at all. Maybe it's something that is not interesting to you. But it's better to find that out now than to pursue a career and then realize that it's not something that you want to do. So yeah, there are lots and lots of opportunities. One of the things that you guys have here in this small town is a lot of really, really well and overqualified professors, right? Because there are not a lot of faculty jobs. There are not a lot of places for people who have PhDs to go and work. And so therefore, as opposed to having mostly graduate students teaching your classes, you have a lot of faculty who are teaching your classes, and that's amazing. So use them because they want to give this to you. They want to give their passion and their excitement about their research to you, for sure. Anybody else?
Usually have more questions.
Yes.
What are usually like your work hours, or like what do you do on your day-to-day basis?
So, I mean, the nice thing about work hours is you can kind of go when you want. You know, a typical day is a typical day for me was a lot of, you know, phone calls, data entry, you know, organizing things as far as that's concerned, meetings after meetings after meetings. I would work my schedule around that. So if some days I would go in at 10, some days I would be in at 7. And that part of it's really nice. That there is some flexibility in that you can kind of work it around when you teach, when you have meetings, when you need to be in your lab, those kinds of things. So I would say the vast majority of my last job was meetings. All I did was meet with people. We had this huge project and people were all over the country, and so every 2 weeks I was on an airplane and I was going to some place and I was meeting with all of these statisticians and all of these people from the NIH and the FDA and all of these things, and we met a lot. So that being the case, I was gone for 3 days at a time. I wasn't working like a regular week at my job because I was putting in all this extra time over here. So there is some flexibility in that. Some people do it as a 9 to 5, but it's pretty hard to do because if you're trying to collect data from people, oftentimes you have to do it in the evenings. You have to sometimes do it on the weekend. So, you know, life doesn't run 9 to 5. But that is a nice part. You can kind of make it what you want.
Where do you work?
Well, I don't work anywhere now. So My most recent job was at the University of Michigan, and my husband and I moved here 2 years ago, and he's a physician assistant, and I am now stay-at-home mom. Yeah.
So do you get to like choose the research projects that you work on, or people do like they just approach you and ask you what they want?
Both. So, if there's something you're interested in, seek out somebody who's doing that. So the postdoc that I did at the University of Michigan, so once you have a PhD, then you go and you do another fellowship, essentially, which is a postdoc. I went and worked with the 2 leading researchers in the country for the disease that I was interested in. And I sought them out. I cold called them. I said, I am just finishing up school. I am looking for a place to go. Hire me, please. And they did, and it was great. That doesn't work that way for a lot of people. Some people aren't so focused and don't know exactly what they want to do, and so they'll go and work on lots of different projects to see if they can find something that they're interested in. So, yeah, there's lots of opportunities and lots of options in that way. That if there's something you're interested in, more than likely there's somebody here that's doing some kind of research on it, and figuring out who those people are will be key, and then being able to move forward with that. And then once you get to the PhD level, you can do any research you want. You get to pick, to some extent, right? Because you have to get funding for it. But yeah. And if you do end up going the PhD route, you're going to do research whether you want to or not, because that's just part of the deal. Most master's programs, you're going to do research. So, thinking about as you're progressing through, okay, is this it for me? Is a bachelor's degree it for me, or am I going to go on? If I'm going to go on, what does that look like? If I'm in exercise science, I'm going to find somebody who has a lab, who has the same interests that I have, so that I can do the research that I want to do. When I did my master's at the University of Wyoming, one of the graduate students, they developed a smart bike. This was a long time ago. I know, they're probably all over the place now, but it was really cool then. So as his master's thesis project, they developed this bike that calculated energy expenditure and all of these crazy things as his master's thesis. So he found this person, the grad student found this person who was doing this kind of research and attached himself to him, and that's what they did, which was pretty cool. When I did my master's, I just went with anybody who had sort of the same interests, because nobody really had the same interests that I did. And that's going to happen. But then once you go on a little bit further, finding somebody who has the same interests as you, just because it makes it much more fun if you can do the stuff you're passionate about. Anybody else? All right, well, thank you so much for having me.
All right, so your assignment's going to be talk about what was new information to you, what surprised you about the talk you heard today, what